Hello! Welcome to another episode of the All-Star Podcast. I'm Katie Ray.
I'm Dr. King.
And we are going to talk about some things today. Don't forget, you can catch our podcast on all platforms that you get your podcast from. Google, Facebook, YouTube. Leave us a review.
iTunes.
Send us your questions.
Yep.
iTunes. Please send us your questions. All the questions about veterinary world, All-Stars of business, personal questions, yoga questions. Whatever your little heart desires, send it on over.
We are on episode 12. Hard to believe.
Episode 12.
I think we're getting better with each episode. So bear with us.
Almost into our preteens.
We are, now that you mention it. So I think, the information is getting out there.
Information's getting out there. So we'll discuss veterinary things, and we'll answer some listener questions today. We'll watch some funny videos where you guys will get to see... Oh, my mom.
Oh, hey, Patty.
Hi, Mom.
Okay. I love that we have like one consistent viewer.
Patty Ray. Woo woo.
Patty Ray's in the house.
We are going to a special Mother's Day.
Oh my gosh, though. Wait. I still have got to get to Patty Ray's questions.
Yeah. Hi,
Madeline. Madeline is Harrison's girlfriend, who I love, and she's coming into town on Friday.
Nice.
And so we're gonna.
I've met her once.
She's awesome.
Twice.
She actually, you guys, no kidding. She's the designer of the
For realsies.
For realsies, she designed the entire podcast.
That's
set.
awesome.
Yeah. So I know she's gonna love me telling everybody that.
Can Katie do a handstand?
Maybe
Yes,
on the
Mother,
table,
I would
Patty
love to
Ray.
do a handstand.
On Instagram.
On Instagram. I can do a handstand on this table.
I'm gonna make you do that someday.
Okay, when
I'm gonna have to hold the table for you.
When I get really, really good at handstands and I can safely fall from this high,
I'll just put some padding down. Oh, okay, sure.
I can do an arm balance on this table for sure.
You could definitely
That's
do that.
100% positive.
Okay,
Like
so
right
that's
now.
a goal for us.
Just kidding. I'm doing it right now.
So yeah, Madeline designed the set.
That's awesome. Okay, yeah, we have
So
to.
that's
We
pretty
do have to
exciting.
get. Oh, my mom. I never. Okay,
Yes, we got to get those questions
hold
answered.
on. My mom
Speaking
responded
about-
that one time, and then I never came back with the answer. The water question.
Oh, the kind
The
of
water question. My mother said, she said that the, oh wow, we text a lot. Hold on. Okay, she said the water. The reverse osmosis is a special filter you can put in your house, but I've heard it basically strips all minerals out, but it's supposed to take all the harmful stuff out too. So I think
That sounds pretty good.
it's fine, right? It's just water. If you're just taking things out of it,
I cannot say because I don't know. I do not know.
it's just water. It's fine.
Katie Ray gives it.
It's fine.
And it's fine with an eye roll. It's all good.
Your dog might just be like, ew, reverse osmosis water, but
Okay, that might be.
I can't imagine that would be a problem. And if you know a lot about reverse osmosis water and it's a problem, please let us know.
Can you please contact
Please
us?
let us know.
Okay, so you were getting ready to say because I interrupted you about something about.
I was on. What?
Check the chat. Madeline
What's
says.
up, Madeline?
She says
What a
we're
shout-out. You
great.
guys are great. So much love.
Oh, she's so nice.
That's awesome. I know. I met
It's
her
a
one
crime
time
to
and
be that nice.
I liked her. So
She's so nice. She comes in town and she visits with everybody, and she's so good to the other boys, and she's so nice
that's good.
and fun to be around.
I hope
and fun
my
to talk to.
mother-in-law speaks that highly of me.
I'm sure she does.
I think so.
You're amazing too.
Thank you.
So, yeah.
Okay, so my mom, I had my teacher training all day on Mother's Day, so I didn't get to see my own mother on Mother's Day. So I'm going to take her to dinner on Friday.
So it's like post Mother's Day.
Post Mother's Day, a little dinner.
Where are you going to dinner?
Well, actually, I was going to leave it up to her, and I was going to text her on the way here because I drove past Cooper's Hawk,
Oh,
and I
that's
said
pretty
to
good.
myself, we haven't been there in a while, and my mother loves it.
So Mother's Choice. That's
So
nice.
I was going to leave it Mother's Choice, Mom, unless your choice is Cooper's Hawk, and then that would be legit.
That would be like your choice, but really
It would
her
be my choice, but my mom's pretty. She doesn't really care.
Yeah.
As long as I'm
Just
there.
the two of you going?
Unless my dad can come. I don't think I think Eric's at work, so it may just be us girls. We'll find out. We'll find out. Which would actually be the last time you went to Cooper's Hawk. It was just my mother and I.
Oh, that's so nice. You can have like the wine in the lobby
Yes,
area and then go into
exactly.
the restaurant.
Feeling fancy, so
So today we went to Pet People.
Pet People, yeah.
I took Allie Cook, who's the trainer that we bring on the show sometimes.
Mm-hmm.
She and I went to Pet People, and we've been partnering with Pet People to get people some I feel like I've said people 3 times.
People.
Some information about pets and about their store, and I just really liked it. We had a great time.
That's awesome. I can't wait to see it.
Yeah, a shout out to the store on 146th Street and Trisha, who's the area manager.
Nice.
She was very informative. The store looked great, like it always does, and it was just awesome. It'll be going out like maybe a week from now, Harrison. Is that right?
Not next week, but the week after.
Not next week, but the week after. But
Week and a half, 2 weeks.
yeah, the cool thing is we're doing this really awesome giveaway.
Sweet.
And so if you send in, it's like hundreds of
$100
dollars.
worth?
No, hundreds
Hundreds of
of
dollars
dollars
worth of
in the giveaway basket. It's like ridiculous.
How do I enter?
Ridiculous. You have to have a pet and a picture of your pet, and then you put it in the comment section. There are some rules, which one will probably be like, you cannot be an employee at All Star Veterinary Clinic.
What?
Because you will probably win. So then you know. No, so
I'm
yeah.
a winner, so.
You put your pet's name and the picture of your pet in the comment section, and then we're going to
Cool.
randomly draw them, right, Harrison?
So is that little contest going to be happening on like Facebook and Instagram? So
Yeah.
people can watch out there.
And they're
Facebook,
gonna,
Instagram, look for the rules.
Yeah, so like we did like a video on what you need to, like we were talking about on Tuesday, what you need to have on hand prior to bringing your puppy home.
Yeah.
And so Pet People's going to launch it through their social media, platforms,
Sure.
and then we'll launch it, and then people will see it, and then they can put their puppies or dogs in, whoever they're adopting, and somebody can get the awesome Redunculus basket.
That's awesome.
I mean, they were even so cool. Like, they let us like put in the basket the stuff we talked about while we were at the store.
Wow.
Yeah, I mean, like,
What's
we
in
got a Bobble-Lot.
What is that?
It's like one of my favorite.
A bobble of who?
A Bobble-Lot. It's like for all of us oldies out there, it's like a Weeble Wobble.
Oh,
And
Weebles wobble, but they don't fall down.
Right. And so it's got this little window on the side, and you put food in it, and it dispenses food
Oh,
slowly.
yeah,
over
yeah,
time. But I mean, like we did treats, we did food dispensing devices, we did a food dispensing bowl, they gave a gift card for like $150.
Whoa.
Yeah, it's pretty awesome.
That is awesome.
So I think somebody will be really happy when they win it.
I used to buy Nala's dog food there, but now she and Wilfred get the same food, and they're on JD, so
Well, that's a little harder.
it is for sure.
But they're really, they really know their stuff there. So if you have questions, they're willing to fit like leashes and collars and stuff like that, which is really cool. So
that's cool.
So anyway, that's what we did this morning. So that was pretty exciting.
Keep a lookout for that contest.
Yep. We went out into the community. So
That's awesome.
That was fun.
What else happened this week?
So, yeah, I mean, that was my exciting thing. Besides, it's race weekend, so we got some of that going down. But
What else? Oh yeah, my friend's daughter's first birthday is this weekend, so that will be exciting.
yeah. So, and if I didn't mention it, Madeline's coming to visit, and I already mentioned it, so we're good. Okay.
Yay! That's great.
All right. So, one of our questions this week is that
This is a good, solid question.
I get this question a lot.
I do too.
And I wonder if people that own them get the question a lot. Probably so.
I bet you.
Or they get the eye look.
The
Or
eye look, the assumption, oh, there's this dog, I'm just going to go ahead and cross the street now and protect
Yeah.
my children.
So the question is,
Are pit bulls actually bad or mean?
dangerous.
Dangerous.
Is it dangerous, right, Harrison? Are pit bulls actually
Are
dangerous?
pit bulls actually dangerous?
So I think that is the question.
Yes.
And it gets formed to me like other forms, like, are pit bulls a good breed to have? Are all pit bulls mean?
Are pit bulls bad with kids?
Right. I mean, like, so there's like different ways of
Yeah.
phrasing that same sentiment. But,
Yep.
I think they're outlawed in quite a few like apartment complexes
Yep.
or even communities. I
Yep.
think in some communities, certainly the breed is designed to be used for a certain purpose because of the way their jaw is and the
Yep.
size and their muscle mass. So they're very good at pulling.
And how cute they are.
Right.
Just so cute.
So I think that, I mean, my opinion on pit bulls is that we have plenty of nice pit bulls. And
Plenty.
that I'm kind of a believer over nurture over nature, like in that standpoint, that just because it's a pit bull doesn't mean that it's mean.
Yeah.
So, but you can train it to be mean.
Yes.
And it would be a very good mean dog.
Yes.
But so are Dobermans, and
Yep.
so are German Shepherds,
Yep.
and so are Chows.
And dachshunds. So
Dachshunds, Harrison. So I think that it really is about how you work with the dog. What
It
you
is.
teach the dog.
That's what I was about. That's what I was gonna say. Any breed has the potential to be mean. Any one of
Absolutely.
them. So pit bulls get a bad rap because if they're either not trained properly or they're trained to be mean, then they're very good at that.
Right.
But the pitties that we see here, the good ones far outweigh the mean ones.
Oh, absolutely.
Like I can't even think of a mean pitty off the top of my head. Like,
Yeah.
So for the most part, they're really sweet, and it's about training, socialization, and getting them used to people. Their feet getting touched, their ears getting touched,
Right.
and
Which is what we were talking about last time
Yep.
with the puppy training, like
Yep.
3 to 16 weeks. You have all these windows you need to jump through, these hoops you need to jump through.
Yeah.
And those things slam shut,
Yeah.
you know, and people do adopt some of these patients like they're 6 or 8 months old,
Yeah.
you know, and so they can have trouble with them, but that can be any breed. It doesn't
Yes.
necessarily mean a pit bull.
Yeah, and then
So-
I also think that there's a difference between fear aggression and like I'm gonna be mean just to cause you harm.
Oh yeah, I think there's 5 different forms of
Yeah.
aggression. I might be
Something.
wrong on that, but there's like 5 different forms of aggression. That's why it's so hard when people come in and they want a pill to treat aggression, or they
Yeah.
want some kind of like
It
magic
depends
bullet,
on
if
what
you
it
will.
is.
Right. I mean, you have to identify each one of the forms of aggression because they might not just have one; they might have 3 of the 5 or 5 of the 5.
True.
And so then you have to be able to put things in place to manage
Yep.
the patient.
Yeah.
So I would say not all that they're not just
More often than not,
Right.
they're just fine.
yeah.
Yeah, we had the sweetest little girl yesterday come in, and she was just her mom literally had a alert, if you will, on her harness that said "I am friendly."
Ah, that's so
Because
cute.
people will walk down the street, see a pit bull coming, and cross the street, or
Right.
like turn around and like go the other way. And she said that it's really sad because her dog is like super super sweet, and everybody's scared of her for no reason.
For no reason, yeah. But, you know, I mean, that's because, you know, you're going to hear on the news the stories of, you know, there's a runner running down through a neighborhood. 2 pit bulls get out of the house. They run
Yes.
down the
Yeah.
runner, you know.
Because-
I mean, those are the stories that
Yeah.
you hear.
Yeah.
You know, but I don't think that necessarily it's just that breed. I mean, that can be 2 German Shepherds living in a house.
Yep.
It can be that pack mentality, you know, but I think that people themselves have an obligation to keep themselves safe.
Oh, for
So
sure.
I think, you know, in those scenarios, I always counsel people they need to take something with them to protect themselves.
Yeah.
You know, so usually it's like pepper spray is a great thing you
Yeah.
can have,
Yeah.
you know, but it's not just them, it's everybody.
It's everybody. And I think also with the pit bulls getting the bad rap is like if a dog does something in the news, they say a dog.
A dog, yeah.
If it's a pit bull, they'll say a pit bull.
Sure, yeah.
So every other breed is categorized as dog.
right.
Pit bulls get mentioned by name.
Right. You remember when it used to be chows or, you know, like I don't think I'm any more afraid of a pit bull than a chow or a German Shepherd or, you know what I mean?
I would say some of those other breeds I am more.
Chihuahua.
Chihuahuas can be super sweet or really mean.
Like we call them land sharks.
They're little land sharks.
Yeah,
so
'cause they can be-
bless their hearts.
And they're fast.
That's probably the biggest issue is that they're way faster.
They're fast and they're small, so they're
Yeah.
very difficult to restrain.
Yep.
So, you know, when we restrain animals that are aggressive, we do it in such a manner to keep people from getting injured.
Keep us safe, keep them safe.
Right. And they are hard to restrain. I mean, there's just no great way to hold them.
Yeah. Yeah. So,
that's their. I think they're the small mean dog is the hardest dog to work with.
yes, for the most part.
I mean, unless it's like a bull mastiff who could like
There's,
tower
I mean,
over you.
in my days, in my 7 or so odd years of being a tech, there's one dog that I used to know that was like 140 pounds, and he would lunge for your throat like that. Obviously,
that's scary.
Chihuahua biting you is gonna hurt, might draw some blood, but you're gonna live. Like, you know, if that big of a dog were to actually attack you, like cause some serious damage.
Yeah.
You know, so like in that aspect, the bigger dog would be scarier. But I would on a weekly, monthly basis, it's the small dogs.
Yeah, for sure.
The bigger dogs are usually the gentle giants.
Yeah, I have never. The other common question I get all the time is, "Have you ever been bit?" And I have not, believe it or not, never been bit by a dog.
Are you flipping serious?
I've been bitten by a ferret. And it hurt, it hurt like son of a gun. Yes, and I was in front of a client, and the ferret. This was when I worked at Kreider Veterinary Clinic, and we saw exotics, and I had this ferret in front of me, and I was like, okay, I'm going to look at it. And it lashed onto my finger, and it took all of my willpower not to be like, whoa, and throw it across the room. I was like, and he's biting me, and he's biting me. I have never gotten bit by a dog.
I cannot even believe that. Well,
but
good
I'm
for
really
you.
like way overcautious. You're
You're overcautious, but also I'm gonna defend myself here and say that as my job as the technician,
Yes.
it's my job to stop the doctor from getting bit.
Yes,
which is why I have been bit several times.
I thank you guys for
It's-
throwing your bodies on the line.
I've probably been bit maybe 5 or 6 times in the last 7 years, which I feel like is pretty good.
Yes.
That's not too much. The last time I get bit too, it was the dog was like slightly sedated, and it was totally my fault because like
You just didn't think
he
that it
was
was
like
gonna-
we were trying to shave his belly for surgery, and he was like a year old, and I had him laying on his back, and I was rubbing his belly, and he was just like asleep. And then I think he like woke up and was like, wait, what's happening? So he kind of just like reached up and like bit my arm, and I was all like, what was that for? And then he bit my hand, and I was like, oh.
He surprised you.
I think, and then he like got up, and then he was like, I'm okay. So like sedation and stuff can cause like weird little like he woke up and was like, where am I? Oh no, I'm good.
Yes.
You know?
Yeah,
so,
exactly.
Like, but I think I literally made that noise. I went, that was rude. Like,
Yes.
you know?
Like, what is going on here?
So-
So looks like on our this is instant messaging, right? I gotta give a shout
What are you
out to my Aunt Janice joined the chat.
Hi, Janice.
She is my father's older sister. I love you. And she is trying to recover from some pneumonia right now.
Ooh.
So Janice, man, you're not going to make it to the race party, which totally sucks.
Bummer.
1, because I will miss visiting with you, but 2, because how the hell am I supposed to get spinach salad dressing, bacon hot spinach salad dressing now? That was what I was looking forward to on Sunday.
Is that another listener question? How are you going to do that?
How am I going to get the bacon spinach salad dressing? That is her specialty. She brings it every year. They bring lettuce from their garden, and then she makes the hot spinach bacon salad dressing.
That sounds amazing.
It's so good.
Sounds really good.
But clearly, I want her to get better. So
Of course. Of course.
But so that's my dad's older sister. She's awesome.
That's good.
He's got a lot of siblings. They're all awesome.
My dad has a lot of siblings too.
Yep. They grew up on Hall Street. Hallville.
Oh.
They call it Hallville. 10th Street.
My dad is
Indianapolis. Hardcore.
My dad's the second oldest of 6. 5 boys, 1 girl.
Yeah. See, there were 7 in their family.
Oh, nice.
Yep. 3 boys.
Yeah.
4 girls. That word got around. Thanks for the plug.
Yes.
Awesome job, guys. Great information to share.
Thanks, Crystal.
Thanks, Crystal.
We appreciate that. And if there's any other topics you want to hear about, let us know.
Yeah, for real. Any dog has the potential to be mean. It's all how they're raised, trained, and their just general personality.
Yeah, absolutely.
Wilfred was he was showing signs of aggression at like 9 months old when I first got him. Whipped his butt into shape. Just kidding. I still have to muzzle him for exams.
Yeah. And it's so hard. I feel so bad for folks because when they have aggression, they don't want to give up on the pet.
Yeah.
But yet at the same time, you're talking about in some of these patients, a 12 to 15 year commitment, which is very anxiety provoking.
Yes.
And so it's a big struggle, I think, for the family to, be in that scenario. It's just so difficult.
Yeah.
No one wants to consider euthanasia, but no one wants to consider the fact that the pet's a liability.
Yes.
So there's this constant back and forth between,
sure.
and so trying to prevent those scenarios is really what we're trying to do by
Definitely prevent them.
educating and putting the information out there.
Something that we do here is I would say for the most part, if a pet is showing aggression at the vet, it's more than likely fear based. Mm-hmm. Because we're poking, we're prodding, we can't tell them this will only take 2 seconds.
Sure.
We're holding them in ways they've never been held. There's needles in them. So I would say that 9 times out of 10, for the most part, it's usually fear-based. So that's why we have taken steps to be fear-free.
Right.
We're not necessarily certified yet or going to be, I don't know. But just being able to move slower with pets and
techniques.
Little techniques to help ease and soothe their visit here to decrease their stress and anxiety is one way that we help.
Well, and it can be really aggravating, I know, to some pet owners when we're like, ooh, we really don't want to hog tie your pet.
Yeah.
Because they're, time is money to people. And
Yes.
time is a very valuable commodity. They've taken their time to come over. They just want to mark this off their list.
Yep.
They want to get the nail trim done.
Yep.
Their wife said they had to get it done by Thursday.
Right.
They're in the clinic. They're like, can't you just get it done? And, it's... It's hard because we totally get, we want to make the owner happy or the client happy because we know that's something they've got to get finished or get done. But at the same time, we're making the scenario worse on everybody by manhandling the patient.
Yep.
So using the fear-free techniques is definitely help. But then also drug therapy. We're not afraid to send those patients back home with appropriate drug therapy to make the visit easier.
Yeah. And I have to do that for my own dog. So I hate seeing him sedated, but I would rather see him sedated and relatively calm for his exam and his blood draw and all that good stuff than, bucking up and down like a horse, expressing his anal glands, screaming at the top of his lungs.
Yeah.
So it's a more enjoyable experience. Maybe not enjoyable, but it's an easier experience for him and everybody else involved.
Well, yeah, because the experience needs to be pleasant. And so, that's the objective anyway.
Yep.
If the patient is struggling and we're manhandling them, the way dogs' brains work is they are going to escalate their response.
Yes.
So if spinning around and doing somersaults doesn't get them away from having to have a nail trim, the next time they come in, they're going to spin around and do somersaults, but now they're going to also try and grab you with their mouth, when they're on the ground or they spin around with their head up, they're going to now start biting you.
Yeah.
So they just keep escalating their response to get what they need.
And worse,
and it gets worse and worse. So
and that's not
really
fair.
and that's really what we're trying to, by intervening, saying, okay, you know what? Let's not take it to the next level. Let's keep it a pleasant experience.
Yes.
So let's use drug therapy or let's do
We've
behavior modification or...
We've had great success.
Yeah.
And there's been several cases where we use the drug therapy for several visits, and then they can even start to slowly not do the drug therapy, and the dog's okay.
Yeah, absolutely. And
so it doesn't have to be a forever thing.
Exactly. Yeah. I think from a business standpoint too, we always have to keep in mind that we can't let our employees get bit.
Yeah.
It's a liability. The insurance companies will drop you, so those things also have to be considered. That's why it's such,
For
hard.
sure.
But to get back to the main question, are pit bulls dangerous?
No.
No. Not all of them. If they are trained to be that way, just like a German Shepherd or a Labrador Retriever or a Doberman Pinscher, then yes, but otherwise no. Okay. So, Kyle, I got to give a shout out to Kyle because Kyle Rowe is an artist that is a client here.
Hi, Kyle.
And he has got a little bitty dog, this little bitty thing. And a Sadie, if I'm right. And she coughs all the time, so we talk about that as trying to manage her coughing. But he is an artist, and he does some wicked stuff. So, how would you describe it, Harrison? It's
Very oil painting.
yeah, Kyle.
Oil painting-esque?
Yeah, but it's like.
I'll pull up a picture.
Yeah, pull up a
Okay,
picture.
yeah,
So
I
I
wanna
had
see
Kyle do Johnny's. Show him Johnny's. You could show him Johnny's mural too. I had Kyle do a mural in Johnny's room because he's been begging me for, get this, a crown with his name on it on his wall. I know, Katie.
Like a crown?
Yes.
Like he's the king of Game of Thrones?
Pretty much. So he has
is
a
the
crown. So
ruler,
Kyle, yes.
protector of the realms?
So yes. So Kyle designed this crown for him.
Johnny.
Okay. And it's a really cool crown. He did a very good job. And it's big though. It's like 4 feet wide.
Whoa.
And it's on his wall above his bed. And then it has his name in the middle of it. And it says Johnny in the middle of it.
That's legit.
It's really legit. It's very cool.
Oh, yeah.
But yeah, this is his work. You can see it's really cool.
Yeah, that's awesome.
So anyway, shout out to Kyle, man. Guys,
Hi, Kyle.
if you ever need anything like that, he does a great job. And he's timely,
That's good.
which I value.
That's very
'Cause
good.
it is one
Because
of our core
time is so
values.
important.
Boom. Okay, so Harrison, what else you got for us today?
He said,
I do not.
You got nothing.
we got fun videos?
Yeah, you got some fun videos.
We have fun videos, but if there's anything else veterinary related you want to talk about,
Anything else veterinary related that we want to talk about?
Let's see.
interesting shortages that have happened recently,
Well, we talked on Tuesday about some of our
It's
surgeries.
hard because we've only had 2 days in between.
Yeah, as we were picking up some.
I mean, I said, when you guys were talking about the bites, I asked, what's the worst bite you've ever had?
Me was a ferret.
Okay, can I tell a story about myself and then one bite that I saw?
Yeah.
Okay, the worst one I ever had, I was an assistant. I'd only been working at this clinic for like a month.
Oh my gosh.
Did not know dog behavior signs. Didn't have any idea, right? So I was brand new. I was still in school. Never worked in the vet in my life.
Oh my gosh.
And I had to go get a Maltese out.
Oh.
Small dogs.
Small dogs.
So I reached into his kennel. And now looking back, I'm like, there were 35 signs that he was going to bite me, and I didn't see it. Mm-hmm. So I reached into the kennel with both hands to pick him up, and he bit, like, I think 8 of my 10 fingers before I realized what was happening. Because also, I didn't have the reflexes now. Like, now I can identify the body language. I'd be able to take the proper precautions, and if there is a snap, I'm able to get out of the way in time, right? Mm-hmm. I was not expecting it, not paying any attention, didn't know, and I reached in there with both hands to pick him up, and I got here, and he went, bah, 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 bah. And I was like, and then finally pulled my hands away, and like he bit like 8 of the 10 fingers, and they were all bleeding, like all of them. Oh my gosh. And fun
fact,
did he
have any teeth?
Oh yeah, he had lots of teeth. He had a lot of teeth. He bit another assistant and a doctor that day.
Oh my gosh.
Yeah, he was one that I would argue may not be fear, and he wanted
just
my blood.
Yeah. Oh my gosh.
So that was mine. One of the other story is she got bit, but I have never seen this in my life. We had just neutered a cat. And he was waking up from anesthesia, and sometimes the kitty cats waking up from anesthesia, they can get a little like dysphoric, and they kind of are like, what's happening? I was just under sedation, and now I'm awake, and my testicles are gone. Like, what's happening? So
I'm sure that's exactly.
They're like,
Oh god.
So the technician was getting ready to move the cat back to his box and his carrier to safely wake up with a blanket and a towel and all that good stuff, right? Well, he started to wake up much faster than she anticipated. Mm-hmm. So she scruffed him, and she had him scruffed behind his neck like you do with kittens sometimes, and she went to pick up his back feet, and she was like this. And had I not witnessed it, I would not have believed it. She literally had the back of his head scruffed, like right here, and he turned his head all the way around and bit her hand that was holding the back of his head.
Oh my gosh.
I literally was like, oh my, like seriously, like Exorcist, just like he detached his mouth and it came around and it bit her in the hand. Spun straight around.
Cats are like that, man. They can do, that's why their skin is so loose.
I literally was like, what just happened? So she's like, like trying not to drop him. So she got him into the carrier. But
I would say a lot of people are more scared of cats than dogs.
Yeah, I'm more
because
scared
of cat bites.
Yeah.
You know what I mean? Like, and the problem that cat bites can cause.
Yeah, and cats are so much more.
I think they're unpredictable.
That's what I was about to say. Technically, there's always a sign, bleep, blop, bloop. But no. I was bit by a cat once. He was totally calm. I had him right in between my arms. He was hiding his head in there, and he was just hanging out. And he, all of a sudden, he just picked his head up, and he looked around. And then he bit me in the forearm. Like, no warning. He was. I think I was holding him for 10 straight minutes, and then
he decided to bite you.
Just
Isn't
bit me
that
right in the
weird?
forearm.
Cats are just so strange.
He got like there was like 3 of the 4 canines were like bleeding from my arm.
Yeah.
So.
Their cat behavior is just a whole different ballgame.
There are some very awesome sweet cats out there. Shout out to Griff, my boy, but some cats are not nice.
Griff was getting a beat down this morning by Chief. It was the best. I mean, I wish I had a camera. So they're sitting on top of the lab equipment machine, right? We're all sitting there watching.
Griff and Chief are house clinic cats, by the way.
Yes.
So he wasn't getting
named after a video game. Okay.
Griff and Chief.
Okay, so he's sitting here like we're sitting like this, like as if we're the cats. Okay, I'm Chief, you're Griff. All right. So he puts yes, go ahead, be Griff.
Griff's all like
he's a wimp, guys. Okay,
that's why he's my special boy.
Okay, so they're sitting there and Griff's laying on his side like cats do. Okay, like that, and Chief is like this, pushes his head down. Okay, Griff tries to pick his head up, and he goes, "Get down, get down." Griff tries to sit up, and he takes his head like this. He goes, "Get down." And so it was hilarious. This went on for probably 2 minutes.
Oh my gosh.
And he's like, nope, down.
And Griff just kept letting it
down.
happen.
He'd sit up and he'd go, down. I mean, it was the best. It was hilarious. I was like, he's getting a bait down.
Griff
and so
does
finally
not
he's
care.
like, all
He's
right,
like,
I guess I'll just
whatever,
lay
I
down.
guess.
And then Chief sat up and was like, yeah, that's right.
That's
So
right.
it
I'm
was-
your boss now.
It was great. It was,
Griff is so funny. I love him so much.
it was awesome.
Okay. Anything else veterinary related?
Actually, you know what? I actually might start doing a segment where I go onto Reddit and I find veterinary-related questions because a lot of people have like questions like this.
Yes, I think that's a great idea.
And so
You want to hit us with another question?
Here's one that's unique. My dog sniffed near fence paint. Yesterday I was painting the fence and my dog came. Actually, you know what? Here. How about you guys? Can you guys read that?
My
No.
dog sniffed near, it's just down too
You
low.
gotta go up.
Yesterday I was painting the fence and my dog came close and sniffed and started coughing.
Come on, talk about the mic so that you know.
She wasn't actually right up to the paint, just beside it. The coughing could have been because she was barking constantly beforehand at a dog in another garden. She has been okay today and has been eating and drinking. Should I still be worried? No. It's not coughing today. What would you say?
It's not coughing today. Is that what that said?
Mm-hmm.
I was trying to read the comments at the same time. Nah, it's fine. It's fine. Like
I
she-
would say that the coughing was definitely related to the barking.
Probably more related to the barking, and it might be like they have a stronger sense of smell, so maybe it was like a and then like moving
Right.
on, but like they're fine. Like as long as you, we just made those noises into the mic. You're welcome. As long as they didn't lick it, right?
Yeah. I mean, you'd have to lick the whole paint. You'd have to lick the entire fence that the owner just painted, lick it clean, and maybe you'd have a problem.
And then like huff the paint fumes straight out of the container, right?
Or just take the paint cannon.
Just drink it. Yeah. Okay. So as long as your Yorkie did not drink the paint, that's fine.
Yeah, I think you're good.
Another one. We can do this one. We can do funny clips. I'm not going to pull it up on there. I'll just read it to you because it's kind of long. There's a potential new puppy that this couple is looking for that has a small umbilical hernia,
Okay.
and they are curious if the umbilical hernia will cause issues in the future. Given that she is young, is there any chance the hernia will close? Is this something that should be corrected when we have her spayed in a few months?
Yes. Okay. So in case you can't hear Harrison, the question basically is
I have it pulled up here.
puppies have. No one can read that. That's way too small. All right. Well, do you fix an umbilical hernia as a puppy? Yes.
When it's spayed
When it's spayed
or neutered.
or neutered. While they're already under anesthesia, you fix it.
That makes sense to do it then.
So what is a hernia?
What is a hernia? It's a hole into the abdominal wall, through the abdominal wall, into the abdominal cavity. Mm-hmm. Umbilical hernia is from the umbilicus, so like the umbilical cord.
The umbilical cord, and it usually presents as a little soft tissue, like fatty feeling little bump right on their belly,
Or a hole.
or a hole, straight up hole,
An outie or an innie.
outie or an innie. Yeah.
Can some of them close? I think that was the other question. So it's not that they close as much as that fat, like what you're mentioning. So
Yeah.
you get that soft tissue that pooches through the hernia.
Yep.
That then sits under the skin. That gets hardened and gets like fibrous down, so it almost like scars down around it. Well, then it can't go back into the abdomen, so you get an outie belly button basically. So it's fixed because nothing else coming through there.
Yeah.
But yet you can't push it back in.
Yeah.
So usually, again, at the time they're spayed or neutered, we usually just freshen that area and then close the hernia.
It's super fast,
Super
super
easy.
easy. Yeah.
It's never going to lead to a problem later down
Yep.
the road. However, I will say that some defects come in pairs. So like say for instance, if you had like an umbilical hernia and then you also had a heart murmur and then you also had something else. You know what I mean? Like we can see those kinds of things come together, but the hernia
Sure.
itself moving forward shouldn't cause any
Shouldn't
problems.
cause any more problems. Yeah.
Yeah. So
Yeah. So I'd recommend doing that.
just surgically repair.
Especially because they can be big or little. I think actually my sister's dog, I don't think her umbilical hernia was ever fixed, and it did the harden over outie belly button thing.
Yeah, some of them come spayed, and the person who's like the shelter who spayed them did not fix the hernia, and so then you get the outie belly button. You can't push it back in. Nothing else is coming out. You just leave them.
Yeah.
They're not
At that
gonna
point, it's
cause
too
any
late.
trouble.
But while
Yeah.
they're already under anesthesia, it takes an extra 10 minutes, maybe.
For sure.
Not even.
Why does something like that happen?
just does.
Why do humans get outie belly buttons?
No, It just, I mean, you know, sometimes it can have to do with the mother. So like when the mother has the puppies, they bite off the umbilical cord, swallow the placenta, and maybe they do that a little too close to the abdominal wall. And so then that, you know what I mean? Then you don't get that sealing shut. So what should happen is there should be an inch or so of umbilical cord still left on the puppy. That dries up. The wall's closing at the same time. And then that falls off and everybody moves on and does fine. But if the mom just chews it way down there, then that's not good. Yeah. Things you didn't want to know your dog did.
Yeah.
Okay.
And, we'll not say the word placenta again.
Placenta. Okay.
Funny videos,
all right, funny
the part of the
videos.
show where we watch some funny videos.
Funny video. Beep.
We're about to watch some funny videos.
You know what I've really missed?
What?
Our welcome thing. Okay, go for it. Can you do it?
Welcome to Illyria. I mean, the All-Star Podcast.
Exactly. Oh my God, that's hilarious.
Did he just handstand down the stairs? Oh my God.
He doesn't even look like he's real.
He did.
He looks like he's
What is that, a Frenchie?
Yes.
A little Frenchie?
Oh no, it might be an English bulldog puppy.
English bulldog puppy. Okay, well, he's wearing a costume, and he tries to go down the stairs, and he is a little top-heavy, so he goes up into a handstand and ends up kind of jumping down the stairs, but he nails the landing. So
He totally nails
stuck
the
that landing.
All four legs just go beep.
Beep. That was pretty cute. Oh,
Jenga.
chocolate lab against Jenga. Dog is a boss at Jenga.
Oh no, he's getting it.
What? This puppy just took a Jenga
She's
block
the
and did
star
not
of
knock
the
it down.
party.
I am honestly impressed. That's amazing.
She gets it. She pulls it strategically.
Oh,
That's
everybody
so
just
cute.
freaked out. That's adorable.
Aw, she's a chocolate lab.
I like it. Okay, he took the speaker out of his toy. Uh-oh. Is he just...
He's holding the squeaker.
He's
Yeah,
just
the tip
holding
of
the
it.
squeaker?
It's coming out the tip of his mouth. Oh, you better get that away from him.
Yeah, he's
Yeah, I
going
was
to
gonna
swallow
say-
that.
Oh, that's going right down. We'll see you tomorrow for surgery, buddy. That's hilarious.
He's just squeaking it.
Oh my goodness. That's so
Oh,
cute.
that's adorable.
Until the dog swallows it. Yeah, that's what it.
Oh my gosh. Okay, dog trying to do a flip on the trampoline.
Another bulldog.
Another bulldog. Here we go. Do a flip, buddy. Ah! The bulldog's trying to do flips, but he keeps falling off the trampoline. Oh, he did a somersault.
He's really good.
He is really good.
He can't figure it.
You're so close. Ah!
Oh,
That's
oh,
really
get it. Yeah, he's
Bulldog
very cute.
puppies are one of the cutest things ever. Oh, you did it.
Oh, that's a somersault. That's like a legit somersault.
He can actually somersault. Oops, except that one. Oh.
Aww.
There's 3 dogs. Ah! This is Yoshi. Right?
Yeah.
The Yoshi song?
Look at his tail in the background. Their tongues are coming. Look at his tail. Their tongues are coming out at the time that the.
That's really cute.
That's
Their
cute.
tongues were. Yeah, I don't even know how to describe what we just watched.
Yeah, yeah. Mm.
OMG, the bubbles. Oh, see those 2 pitties in the bathtub. You like the bubbles? Oh my gosh. They're in the bath and they're the ones getting the bubbles all over his face.
Oh my gosh.
You can't even see because of the bubbles. Oh,
Yeah.
that's adorable.
Oh, it's a little kitten. Or a maybe young adult.
It's a kitten. What's it doing? Oh, is it gonna
That's like a music box or
It's
something.
gonna put it to sleep. Kitten's watching the music box.
And he's almost
And
asleep.
it's putting him to sleep. Sitting up.
Oh my gosh, that's so cute.
Oh, that's adorable.
And he's asleep.
Aww. Okay,
Right.
we've got to. Whoa!
That scared me.
Oh my gosh, scared me too.
No way. They've got a freaking
That's a goat?
There's a freaking goat in the drawer.
This cat approaches the bottom drawer of a dresser that's slightly open. And then something makes a noise inside the drawer. The cat jumps back and a goat. Oh my gosh, a goat.
Jumps out. Not jumps out, but gets out of the.
A goat gets out of the drawer. That's hilarious. I was not expecting a goat. I was like,
was
that's a
not.
weird cat.
I was not expecting a goat.
Oh my gosh, that's so funny.
All
That's
right.
pretty cute.
Well, that wraps up our videos.
Wraps it up. All right, so please leave us a review. Send us your questions. You can send your questions to asvcpodcasts@gmail.com.
Yes, that's it. You got it.
I got it.
You got
Woo!
it. Good job.
You can also send us your questions on Facebook, Instagram. Catch us anywhere that you get your podcast at.
Yeah, check out all the other video series and
Check out on the video series.
let us know what you'd like to talk about
Yeah.
with you.
What?
Next Day in the Life episode is coming out
Next week. Next day in the life videos. Those are so much
It's
fun.
going to contain some C-section
Yeah,
information.
you might see some placenta.
Video.
Oh, prank on the doctors. I was so confused for that. I was standing in treatment when it went down.
When it went down.
I won't give it away, but I was standing in treatment when it went down, and I was like, "What's happening?"
Yeah.
But yeah, that's fun.
All right.
I'm Katie Ray.
I'm Dr. King.
We'll see you next time.
See you next time.